Why do you think, I mean, when people say or hear stem cell replacement therapy, there's kind of a controversy associated with it. What is that about?
I think it mostly has to do with knowing the difference between embryonic stem cells or fetal stem cells and adult stem cells.
Mm,
So embryonic or fetal stem cells are designed to make a baby. It certainly back in the 90s, there was a big cry because they were using aborted fetuses to harvest these cells and try to make them uh, some type of medical use. And obviously, there's a lot of ethical concerns with using aborted tissue. However, adult stem cells are what we're born with. We're born with these adult stem cells that live in our bone marrow. They live in their peripheral fat. They live in the muscle. They live in dental pulp. That can migrate to inflammation and help us heal. And it sounds a little counterintuitive, but when a baby's born, the umbilical cord is chock full of adult stem cells, not fetal stem cells. And that's because about 2/3 of the way through the second trimester, the baby's completely formed. So it's just growing. And that's when these fetal stem cells become adult stem cells. Adult stem cells are designed to heal. And 99% of all umbilical cords just get thrown away in the United States when
hmm
it has a product in there that can heal.
Yeah, yeah, exactly. So where are you getting the treatment then for these individuals, and what umbilical cord blood are you accessing for the treatments, I guess is the
Okay,
question.
yeah. Well, like I briefly said before, umbilical cord stem cells are not used in medicine. Okay, they've been around for 60 years. There's 80 different diseases that they treat. So the FDA there's a huge safety profile. They control all aspects of it. So LeoCorps is where I get them from. They're a pharmaceutical company, big biologic division. I believe that it's an outstanding product, and they get them from healthy born babies in the United States,
Hmm,
women who donate their cord and their cord blood.
wow.
So there's a screening process of the mother and the father in the baby. The baby's born, the blood is collected out of the umbilical cord, and then the cord is harvested as well. It gets sent to the lab. It has to be processed within 48 hours. So it's processed, the stem cells are extracted, purified, and then you wait on the blood work of the mother who gets tested for HIV and
Right.
hepatitis A, B, and C, human T cell leukemia virus, Zika, West Nile, Chagas, CMV, uh, you know, all sorts of Lyme's disease, everything that needs to be tested for, it's tested for. And then if it passes, donor screening, then it gets reviewed by a third party doctor. And if it gets released on the open market. And once again, there's kids that may need you don't hear about a bone marrow transplant anymore because kids with leukemia can have their whole immune system reconstituted with umbilical cord blood.
Hmm,
So
wow.
so there's a public bank for it, and we can access it through the public bank.
That's so fascinating. And so not only is this, you have people coming to you for autism, but it's all like traumatic brain injuries and rheumatoid arthritis, autoimmunity,
Stroke.
diabetes as well.
Yes.
Wow.
Uh, all the autoimmune diseases, it looks like one of the final common pathways is a problem with your T helper 17 cell.
Hmm.
And the T helper 17 cell is regulated by a cell called a T regulatory cell. It just turns out that umbilical cord blood is chock full of T regulatory cells.
Wow.
It helps, you know, suppress that. I don't know if the baseline defect is fixed, but there are kids that are getting, umbilical cord blood, and they're having significant remissions where they might need insulin for 6 months to 2 years or something like that. But it can be very effective. Rheumatoid arthritis is another one that people are looking at. Thyroid disease,
Mm.
uh, but injected into a joint, either bad soft tissue like a shoulder, like a rotator cuff, or people who are, have those aches and pains from getting older and are thinking they might need a knee replacement. It's been shown to be able to help regrow new cartilage. So it
Wow.
can turn back the hands of time.
What about other severe mental illness issues, like something like schizophrenia? Have you ever used it for something like that? Is there research on that?
I think there is research on that. Certainly, schizophrenia looks like it can be due to brain inflammation and maybe gut inflammation as well.
Mm-hmm.
And so I think there's these things that we're all finding out is caused by brain inflammation. Um, and it just kind of depends what area of the brain is getting inflamed to what you look like. Chronic pain causes
Yeah.
brain inflammation.
Yep.
And so many people have chronic pain that this might be, help to them. I think umbilical cord blood and its stem cells will be the biggest advance in medicine since antibiotics. We just learned about these things, and they're finding more uses every day. Just
Yeah.
even anti-aging. We all hear about all these cells of mitochondrial dysfunction in autism, mitochondrial dysfunction in Alzheimer's, mitochondrial dysfunction in aging. Well, these cells, they don't go replace cells in your brain. These stem cells don't become part of you. What they have the ability to do is seek out inflamed cells. They nestle up to them, and they secrete these factors called a secretome. One of the main factors is an exosome, and those things get incorporated into the inflamed cells. It has the ability to turn off that inflammation and turn on restoration. And so it has the ability to actually make the mitochondria more efficient.
Wow. Yeah, mitochondria is kind of a hot topic right now in a lot of areas. So yeah,
Right, anti-aging and in brain health.
absolutely. Wow, that's super interesting.